Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about extrapyramidal side effects of antipsychotics. What are the extrapyramidal side effects of antipsychotics? One, we have acute dystonia. Acute dystonia is caused by 1 to 5 days and it causes sustained contraction of the neck, mouth, tongue, eye muscles and opisthotonus. It causes sudden sustained contractions of neck, mouth, tongue, eye muscles and opisthotonus. Treatment of this acute dystonia is it causes benztropine or diphenhydramine is the treatment of acute dystonia. Then we have akathisia. Akathisia is actually, it is in 1 to 4 weeks and it is subjective restlessness. Akathisia is subjective restlessness and urge to move. Subjective restlessness and urge to move the feet, rock back and forth. Treatment of this akathisia is we can give propranolol is actually the drug of choice, but you can also give other drugs like benzodiazepine can be given and diphenhydramine can be given. Then if you see Parkinsonism, obviously anti-Parkinson's drug can be used. Then tardive dyskinesia. Tardive dyskinesia occurs in 1 to 6 months. It is gradual onset of dyskinesia. Here the patient presents with gradual onset of dyskinesia of mouth, face, especially there will be frowning out or sticking out of tongue, frowning out or sticking out of tongue or pursing. Okay, so this tardive dyskinesia in 2017 drug which is valbenazine. This valbenazine is actually approved, has first and only approved treatment for adult with tardive dyskinesia. So this is about the tardive dyskinesia. Thank you for watching.
Thank you and thank you for watching.